One of the most recent advancements in mammographic imaging has been the advent of tomosynthesis or 3D mammography. The Women's Clinic has been on the forefront of incorporating this technology in their practice, and it's very important because it allows us to detect cancers that before were basically invisible to us. The ability to basically scroll through the breast or image through the breast in a way that eliminates overlying tissue has given us clearer and more precise imaging. We're finding more cancers, we're finding them at smaller sizes, earlier stages, and all of that translates to increased survival and decreased morbidity as women go through treatment. So the Women's Clinic has been at the forefront of having this advanced technology, not just in mammography, but in sonography as well. My name is Caroline Reich, and I am a radiologist and specialize in breast imaging. The practice that I run is Women's Imaging Associates, and we provide remote interpretation services primarily for OBGYN offices. One of the reasons we enjoy working with the Women's Clinic is because of their commitment to having high quality mammographic equipment and sonographic equipment. In working with the Women's Clinic, we have access to state-of-the-art equipment, great image quality. There is nobody that we work with that has anything any better than what is offered at the Women's Clinic. The technology, particularly associated with 3D mammography, allows us to be able to detect cancer at a much earlier stage when it is more treatable. Women have a greater chance for survival and decreased morbidity associated with their treatments. We are in the room where a woman would come to get her annual mammogram performed. And this particular unit is a tomosynthesis or 3D mammography unit. One of the things that women are often concerned about when they come for mammography is the pain associated with the compression that's required when a mammogram image is taken. This particular mammography unit is equipped with a curved paddle that is shaped to fit the shape of a woman's breast, resulting in less pain during the compression process. Having state-of-the-art equipment available for patients not only improves image quality, but also improves patient comfort. When a woman comes in for a mammogram, she ends up usually with 4 pictures being taken, 2 views of each breast. CC views, which means cranial caudal, and these MLO views. So we look at each breast from 2 projections. The second thing that's important in evaluating a mammogram is to be able to compare it with what has been done in the past. One of the easiest ways to detect breast cancer is looking at a change from what was seen in the past. With the current study, we try to have a prior study available for comparison. The other thing that's important about prior studies is that it can show us that something that we see that we might be slightly worried about has been stable for several years. So women that have prior studies for comparison generally come back less often for additional views because we're able to tell that what we're seeing is something that's been stable for a while. The current guidelines for screening mammography are that women should start having a mammogram yearly at the age of 40. There has been some controversy around this, and there are some exceptions. If a woman has a family history, a first-degree relative, meaning a mother or a sister, that has had breast cancer at an earlier age than 40, then there may be a reason to start screening mammography earlier. It's very important, in my opinion, for women of average risk to begin their screening program at age 40. And our statistics within our practice, and looking at all of the patients that we examine, 20% of the cancers that we find in asymptomatic women that are coming for screening, are in the age group of 40 to 49. We feel it's extremely important for women in this age to have their screening mammography yearly. The other factor about cancers that are found in the age group between 40 and 49, they tend to be more aggressive, so finding those earlier is particularly important in having a positive outcome for these patients. In the United States, to be able to read mammography, you have to be accredited, and the requirements for accreditation are that you have to read at least 460 mammograms a year. In Europe, the requirements are 5,000 mammograms a year. In our practice, each of us read between 10 to 12,000 mammograms a year, which gives us the experience and the expertise to be able to give the best guidance to our technologists and the best interpretations for our patients.